I work with people who have Lyme disease, and they will say to me, if I just save up enough money, I can get the treatment to be able to work that will heal me. I can go to the Klinghardt clinic in Germany, or I can go to this clinic in Mexico. And if that were the case with chronic Lyme, then so many functional medicine doctors who have it themselves would not still be symptomatic. And I'm not saying that it's a sentence. You can have chronic Lyme and end up not being symptomatic. That's something that I've experienced. Now, it's not 100% of the time. If someone tells you they're going to fully cure you from chronic Lyme, be careful because it's something that persists in your body. But as you strengthen your immune system, you can detox your liver, you clean up your gut, you work on your nervous system, and you build up your life force. Those things will make the symptoms present much less. So I typically don't have symptoms unless I don't sleep well or I'm under a tremendous amount of stress, which triggers mast cell activation. Almost every person I know who has Lyme disease has some mast cell activation or some kind of issue. That stress will also not only affect mast cell activation, but will also start flaring other things which are co-infections. It could be Epstein-Barr, it could be herpes, it could be the cytomegalovirus, it could be mold. There's so many things that can happen. Lyme is not like an isolated bacteria that is just affecting you. It's a whole constellation. But as you start to learn the techniques to calm your nervous system, to build up your life force, to strengthen yourself, just like someone who has herpes that eventually may not have outbreaks anymore, even though it's in their system, it's like Lyme. And it doesn't even matter if you get a test and it says, wow, the Lyme has been wiped out. You still may have symptoms because of all the other co-infections. But the real key is to be able to learn the techniques to pull you out of having a flare. So it's not like, let me just look for the next top doctor to give me this therapy so I can get better, because you're going to rebound. It's learning how to build yourself up, bring down the stress, start to calm your nervous system, and start to build up your energy. For me, so much of it was Tai Chi and Qigong. I've really built up my strength in different types of martial arts. For someone else, it may be yoga, it may be brain retraining. There's so many ways to do it, but you want to learn how to do this on your own and not running like a chicken without a head from doctor to doctor to doctor, because you're going to stay stuck. So start with changing your consciousness, and that's really going to change your overall health and the way that you progress in your healing.